Microphone check. Can those online hear us in the room?
Yes.
Great. Welcome everybody to February Board of Health. And on a snowy day, thank you to everybody for making the trek up to the health department. We appreciate it. So I'll go ahead and call us to order. We do not have anybody for privilege of the floor today, so we'll move right to approval of the January 24th minutes. So if I could get a motion to approve as written, I have a first from Sue, a second from Ravinder. Any discussion or edits on those needed? All in favor is written, and that's unanimous. So we'll go ahead and move on to the financial summary. Brenda is online, right?
Yes, I am.
Oh, hi, Brenda.
Hi. There is no financial summary in your packet again this month. We are still working at closing our books and filing our fourth quarter state aid. And as far as the 2023 year goes, there is not a lot of activity, and the county has just released the billable fringe rate. So I'm hoping to see that post, if not February, in March. So we should have more information for everyone come in the March meeting, I hope.
Thanks, Brenda. Any questions from board members? Hey, Frank?
I don't have anything to report this month, but I'm happy to answer any questions.
Questions for Frank or updates needed from Frank? And so Sam does Sam want to participate or she?
No, she doesn't
Okay.
have any.
Okay, so we're going to, the health promotion report is in your packet for review. So let's go right to Dr. Claypack.
My goodness, we're moving right along. Good morning and almost afternoon. I have my report in your packet. I'd be glad to answer any questions. I must say that I don't think on the COVID front much has changed. And the influenza month on the influenza front, as is expected, you usually see influenza B of the two types. You know, there's influenza A and influenza B. Within influenza A, there are several types that are surface as the time goes by. This point in the year, usually influenza B starts to become more significant. We usually see a bimodal distribution in the prevalency of influenza. And so in the last few weeks, influenza B has been progressively ramping up. So that's to be expected. And one hopes the absolute numbers of influenza don't follow suit, but we don't know that. And we may see the influenza season go on for another couple of months anyway. Other than that, unfortunately, nothing new is broken out particularly. And so that's always good news. Still encourage everyone to get their bivalent booster vaccines. The news still remains good about the utility of that. And people are still having very unpleasant experiences with COVID, especially if they aren't vaccinated. So the message is still the same. Vaccine works, vaccine is safe, and it should be obtained for your own protection. Thank you.
Thank you. Any questions from board members on the report? There's lots more in the report aside from just COVID. So any questions on anything? Okay. Thank you. It's Rachel.
I don't have anything to add to my report. I did just want to pass around. We have an event coming up this Saturday promoting our Moms Plus program and our community health worker program. It's at the public library Borg Warner Room. It's free. The panel discussion about community health and what we can offer, and we want to hear from the community. So if you want to see them, and I'm not sure how many I got, there might not be enough for everybody, but in case you're interested or you want to distribute among your networks.
So this is open, Rachel, this is for community members?
Yeah, this is
Okay.
public. It's presented along with Mom's Comfort Camp.
Oh, yes. Okay.
And there'll be a short film viewing and a panel discussion.
And it looks like there's also free brunch and a diaper giveaway and activities and entertainment for kids. So a great space for parents and caregivers to come. Oh, and you're giving the moms hot chocolate, even
Yeah.
for coffee and coffee.
Chili Fest is also this.
Oh, and Chili Fest is also this
With that, there might also big snowstorm Friday. Saturday. So everybody might be digging out Saturday morning, but
I think they're downplaying the Friday storm, so.
Are
okay,
they?
good.
Okay.
One storm is enough for a week.
So this is Saturday, March 4th from 10:30 to 1:30 at the library in the Borg Warner room.
Yes.
Okay, great. So board members are able to just maybe distribute that among your own networks of people that would be interested. I think that would be great.
Do we have an electronic version of that?
Yes.
Yeah,
We can have, if you can get it to Crunch, you can send it to the board members electronically.
Yeah, definitely will do.
okay. Is our county attorney here? I don't,
He is not.
he's not. Okay. So I'll go, oh, I'm sorry, I skipped over children with special health care needs. Oh, yes, thank you. I'm like, who's where? Anything else, Deb? Okay. Any questions for Deb? Okay, county attorney not here, environmental health, Liz.
So we continue to have 3 vacancies in environmental health. We have 2 support staff vacancies out of 3. And then we also have a vacant senior environmental health specialist. And there are some complicating factors with civil service. And some of the support staff positions especially are hard to fill. So we're not quite sure when we'll be filling these positions. So will have an impact on our workload in the near future. And just one quick update with Grassroots, we did approve them selling their campsite tickets. So I think those went on sale on the 23rd and some of them are already sold out in the day. We did limit tent sales to 75% until we have more information on how they will handle overflow. They have made sites bigger. They have a lot fewer sites, but we're still concerned because they have a limit, because they did that, they have a limited number of overflow sites designated, much smaller than previous years. So but we are working with them and expect that we'll be approving full sales in a bit. They are planning on using Agard Road. They have property at Agard Road that they've used in the past. They're planning on actually having a campground there for culture camp unofficially so far. And we're working with them on that. And then that could also be like a backup overflow section.
Any questions for Liz?
What are the complications in filling the positions?
That would extend the Board of Health meeting quite a bit to fully explain. Some of the positions are just the civil service, there's not there's an active list on the positions we need to fill, civil service list, fire off a list for our support staff positions, but they're not. And then, so then the next test is for various positions. I think the civil service test for the positions we want is now pushed out till June. And so then there's concerns with hiring somebody provisionally, training them, and then having to let them go. We're looking at some temporary options for our support staff position. And then our senior environmental health specialist position. They have not offered a civil service test for that position since 2018. And so a number of our staff are provisional, which could put them in a precarious position to apply for the senior position. A number of our environmental health specialists, yes, are provisional. We would like them to apply for the senior position without concerns about their provisional status and losing a job if they don't pass the test. So we're working with HR on some new developments with that, but that test is currently not scheduled until June also. So
So-
That's the basic core of it, I think.
So what does being provisional mean? That means that you're sort of temporary or?
Haven't taken the civil service
Okay.
test, passed it and been in the top 3, and then we can hire people as permanent.
Got it. Okay.
If they meet that.
So if you fail the test, then it will be offered for another few years so that
You're out of the job.
you're out of the job.
Yes, unless, yeah, right, so.
What's the pass rate on that?
But
What's the pass rate on this?
they haven't offered the environmental health specialist test since 2018. I don't know what the pass rate is.
It's not just passing as well. You have to be reachable
Yeah.
and you have to be in the top 3. You have to score as one of the top 3 people and those that are equal to the lowest score that's in the top 3. So you could, if 15 people take the test, if you're not in that top 3 and you're provisional, we have 60 days to replace you. You lose your position and we have to fill it with someone from the list. So that's the challenge with provisional. And so if somebody has a job somewhere else that they're already permanent in, to come take a provisional title is a difficult ask, right? So it limits the pool. What Liz was referring to with the administrative assistant positions, that is a title that's used in many county departments. And so lists are formed, but folks don't necessarily want to come work in this department. They want to work in another county department. So we could have a valid list, but when they go and screen those folks and ask if they're interested in our position, they can say no. And so we could end up not having 3 people to choose from. Which ultimately puts us in a difficult spot as well. So it's challenges with civil service in general. There is some flexibility that the governor has initiated and HR is looking to help us, particularly with the environmental health specialist, because the exam has been so long. So we're hopeful that that'll help us, but it's getting harder and harder to be competitive in the marketplace with civil service.
Vendor, does that
Yeah.
answer? Okay. Okay. Any other questions? Thank you, Liz, for the schooling on civil service employment, which is unrelated to our.
Let us know because we'd like to know.
Yeah. Okay, anything else for Liz? Okay, Harmony, are you able to jump on for a CSB report?
Sure. The last Community Service Board meeting, we talked about that the LGU, the local government unit for mental hygiene law, will be also getting some opioid funds, some opioid settlement funds specifically to go through that group. So we're looking at how we're going to spend those dollars. And we also did our annual incident review to look at trends. Some of the trends we noticed was a reduction in deaths last year compared to the year before, but an increase in suicide attempts and an increase in violent incidents. So the report also provided some highlights on areas that we're focusing on, which is improving our care coordination or our co-occurring disorder treatment and care coordination with our community providers like the hospital and other people that provide services, looking at our building safety and improving on naloxone distribution. Any
So-
questions?
Yes, I just had a follow-up question. I don't know if it's you or Frank. So what's the relationship between those funds and the opioid task force funds? Are these 2 separate pots of money? Okay.
Yeah, so the way the monies were divvied up is that there were funds that went to the county, which the task force is responsible for administering. And then there's a separate pool of funds that are coming to the local government unit, which the CSB, the Community Services Board, has responsibility for deciding and ultimately administering. So there's 2 sets of dollars. In that second pool, there is also a pass through to the city of Ithaca as well for a pot of money.
So is there going to be conversation across these pools to make sure that we're not all funding the same thing?
Yeah, so the LGU funds that Harmony was referencing, we have to have a tentative plan to them by the middle of March.
Okay.
So we're moving rapidly on that money. The task force for the legislature is moving at a much more deliberate pace. And so they'll know well beforehand what we're doing. And I'm obviously participating in both. So we're, making sure that we're keeping both sides aware of what the other is doing.
Okay. And the pass through to the city of Ithaca, who's managing that?
We're still figuring that out. We talked with Deb Mollenhoff this morning, who's the chief of staff for the city, and alerted them that this money was coming and she was going to talk with her team. We offered, they can take the money and have their own separate city process, but I also offered that if they wanted to be a part of the LGU process, they were welcome to, kind of piggyback on that if that's the route they chose. So they have options on how they can proceed.
Any other questions? Yes. Okay, so that's done with reports then. So we'll move on to our new business. And so there was a placeholder on the agenda for environmental health administrative action, but nothing actually there's and nothing in the packet. So I was assuming that maybe that was just a holdover from last time, but I wanted to make sure. I forgot to ask you before the meeting, Liz, sorry.
Yeah, I'm not aware of anything.
Okay.
I think that was just a holdover from last time.
Okay, yeah, that's totally fine. So we'll move right into the enforcement actions. And I think we have 4 different types of enforcement actions this time. So we'll go through these one by one. So let's start with, hold on, let me just get to the right place in my packet. Let's go ahead and start with, so one thing I wanted to just draw to board members' attention, if you are losing track of where we are on things, is that the division does include for us a summary of open Board of Health enforcement actions. So that's a nice chart that's appearing now at the beginning of the section. So I just wanted to mention that. So let's go ahead and start with, do I have the right one? Benjamin Hill Heights.
Yes.
Yeah. Then let's go ahead and hold on a second. I feel like I'm not in the right place. Is the first one, is this a water order?
Mobile home park.
Mobile home.
It's-
Okay, yeah, sorry.
It is a water order at a mobile home.
At a mobile home park, right? Okay, thank you. I'm just trying to go back and forth between 2 screens, so I want to make sure I'm right. All right, a motion to approve as written. I have a first from Ed and a second from Sue. So let's go ahead, Liz, I'll give you the floor first, please. If you could give us just a brief overview of what's happening here.
So this one, I think, was just brought to the board last month, very recently anyway. This mobile home park needs a booster pump installed so they have adequate pressure. And the owner is quite concerned about constructing this during the winter. He did get a plumber to support his position. So we are proposing to extend the deadline till I think March 31st.
Right, and so
So this is just a minor revision,
it's just a minor revision extending the deadline, correct? Okay.
and that extends the deadline for the, no, it doesn't. Yeah.
It goes till April now or something, right? Yeah, okay. Right, any questions from board members on this? Okay, all in favor as written, and that's unanimous. So let me scroll down here to our next one, which is Zaza Exotics, correct? Yes. Okay, and this is a violation related to underage, sale to underage individuals. So let's go ahead and put this under a motion to approve as written. I have a first from Melissa, a second from Ed. And Liz, I'll give you the floor first to kind of get us.
Yes, so these
Organized.
are a TUPA violations. It's also violations of Board of Health orders. It was it was a sale to an underage person under the age of 21. It was also the sale of a flavored vapor product. So 2 violations with this. The hearing was held on January 9th. They did not show up. The hearing officer has supported the proposed fines of $17.50 for the sale to an underage person, $350 for the sale of flavored vapor products, and $151,500 for violation of Board of Health orders. The previous sales were in July, and that was a flavored vape sale.
Okay, and then this also starts to apply some points, right?
They would get points from the previous July sale.
Yeah.
And this sale, and then I get the points and the violations. Yes, so they would get points because of the sale to an underage minor for the sale on October 18th. And then they would be adding violations to their sum of up to 4 violations before they're referred to the Department of Taxation and Finance. So they have both points and violations.
Okay, and they're 1 point away, I think, at this point from getting revoked, correct?
1 point and I think 1 violation.
Okay, yeah, I think that's right. Okay, any questions on this one? Question? Okay, all in favor is written, and that's unanimous. So let's move to Bailey Park. And this one was related to the workers' comp and disability benefit certification, I think. Yeah, it was documentation and permit related to the permit too. So let's go ahead and put this under motion to approve as written. I have a first from Ravinder and a second from Smara. Okay, Liz.
Yes, this was a mobile home park that was operating without a permit. There's a proposed fine of $500. It was related to their workers submitting the workers' comp and disability information, and they now have a permit.
So they've satisfied this?
Yes.
Okay. And so we're asking them now to
Pay the
pay
penalty.
their fine? Yeah, okay. There questions or discussion on this one? All in favor is written, unanimous. All right, our last one is the North Applegate Apartments. Water, I can't hear. My memory back here. Okay, so this one's water related. If we could get a motion to approve. It's written, we have a first from Melissa and a second from Sue. So Liz.
So this apartment is regulated as a public water supply because they have 5 units. They modified their water treatment system. They changed from a chlorine disinfection system to ultraviolet radiation UV treatment without notifying us or getting our approval. They also have failed to submit the required sampling and monthly operating reports. So we have proposed a penalty of $1,600 and provided there's things in there for submitting the required water samples and operating.
Okay, and the $1,600 penalty is based on?
So that would be based on essentially the number of samples and, so there's violations for making changes to their water system
Okay.
without approval, plus not submitting sample results and monthly operating.
Questions on this one? All in favor is written. Unanimous. Okay, that is our enforcement actions. And then we have one more administrative thing to tackle related to board membership, right?
Yes.
Yeah, could you?
Sure. So I think everyone's aware that as of December, Dr. Evelyn has resigned his position from the board. So we had a vacancy. It was a physician position, so we needed a physician. Normally, when that happens, we form a committee and go out and look for candidates, but fortunately, Dr. Evelyn's successor as chief medical officer at the hospital, Dr. Andrea DeLima, is interested in serving on the Board of Health. And talking with Christina, rather than forming a nominating committee, we felt we would just bring her name forward to the board for consideration. She's Dr. Evelyn's successor at the hospital, having essentially the hospital's chief doctor be a part of the Board of Health, I think would add value for us. But so really where we are is she submitted her application to the legislature and they are awaiting a recommendation from the Board of Health on her appointment. If there's conversation to be had about her in particular, we would need to go into executive session. So we're not talking about that publicly. If not, it would just require a motion from the board to recommend her appointment to the legislature.
Okay, so first, I guess the question is there anyone who would like to go into executive session?
Can I say something positive about her out of section or no? Can I say something in support?
I would limit it to you support the nomination
Yes.
versus talking about things in particular.
So if you would like to do that, we can go into executive session. You feel it's important. If other folks feel.
How long does that take?
Yeah, well, it's just, I have to shut down the.
Oh, okay. You can't just turn on mute them. Or mute us.
You're certainly welcome to say you support the nomination, but if you're going to talk about particulars related to her, we should probably go into executive session.
Nomination, but if anyone wants to know why, we can go into executive session.
Fair enough.
As well.
Okay, so let's do this one at a time. So right now I'm not hearing anybody needing to go into executive session, but I'll allow that to come back on the table at some point if it has to.
Sure.
So I'm going to put under a motion right now, a motion to approve Dr. DeLima as the replacement for Dr. Evelyn on the Board of Health. So
Just to be clear, you're recommending to the legislature.
recommending to the legislature. Thank you. Proving that we would like, the motion is that we're recommending to the legislature that Dr. DeLima be the replacement for Dr. Evelyn on the Board of Health.
Yes,
Is that good?
Perfect.
Right?
perfect.
So,
And I'll say it again.
okay. So is there a first for that? That's okay. A first from Melissa, a second from Sue. Okay, any additional discussion on that needed outside of I support or don't? Okay. Anything else we need to? Okay. And so all in favor? And that's unanimous.
Awesome. We will pass that along around to the legislature.
And then is there anything else the board needs to discuss that wasn't on the agenda? Or that you need to discuss, Brian?
No.
Okay, then I've satisfied all agenda items, so I'm going to call for adjournment and we will see you in March.
Thanks, everyone.